Welcome back to the second portion of the discussion covering teamwork, collaboration, the roles of the healthcare profession. And we left off specifically talking about diversity within healthcare, with our patients, but also amongst ourselves as nurses. And to highlight that conversation, we discussed in the first section of this voiceover the importance and really the recommendations and push and determination to increase diversity, and even began to discuss some of the barriers that may exist as to why it's difficult to enforce this diverse work population. So just a simple graph here showing diversity as it relates to race slash ethnicity. And we did determine the difference between race and ethnicity, right? That race is really the physical characteristics of our genetics of what we belong, who we belong to, where we come from. But ethnicity it gives us a better snapshot of really the ethnic group, the nation, the customs that we came from. So you can see that predominantly, and this information is really not that old, but 85% of race, ethnicity, the workforce here in the United States remains white, non-Hispanic. And by the way, I'm going to throw in still female predominant. We'll talk about males. We talked a little bit about in class about the need to actually increase the number of male nurses here in our country. And then really just small representation of other ethnic groups. So how do we change this? Again, we want to make sure that the profession itself is attractive to those who may be interested or maybe even hesitant to join this profession. It is a rigorous course, you know this, of studies that sometimes is met with great difficulty if English isn't our native language, or if we did not receive our fundamental education in the same manner with the similar rigor that nursing will ask you to have. Again, culture shock is a term when we really suffer from the inability to connect to the culture in which we have entered. Many of you, I'm sure, have had culture shock when it comes to just nursing in general this semester, that this class, and I hear it all the time, no matter what institution I'm working with for on the behalf of, that the first nursing course or two, it feels like it's culture shock. This doesn't feel like anything that you've done before, because the means in which grade evaluations are based on our NCLEX styled examinations. And but keep in mind that we are a profession that is a compassionate profession, and that it really is our responsibility to tend to it. Just so you know, there are professional associations that actually support and offer lots of help for those folks who may feel alienated in our profession. I always would share with students from the school that I was with in Boston, when they would struggle with language, and they were very bright students, and they would say, sometimes it's a word I didn't understand, or even intonation, which we've really worked hard to remove from questions. But they would say to me, I have to translate a little bit before I can answer. So it took time, of course. Or sometimes it was even just things like, wow, you do that here? So even though they had lived here for 6, 7, 8 years. So that always was so obvious to me that they needed a little bit of support. So I did continuously try to share with students, like, cultures that exist here in American healthcare. So, it's really important. And one of the things that I'm always mindful of is that if I traveled to another country and chose in a different language to become a nurse in a similar setting, I'm not sure I could do it. I really am not sure. Men in nursing, we talked a little bit about in class. And we know that it is trending up, yay. But again, 6.2%. That's it. Is the most recent published numbers. really the biggest crutch has been to overcome stereotyping for men in nursing. I'm sure many of you are familiar with the different ways that sometimes men have been portrayed in the media in nursing, and that it's that stereotype like it's a gay man. So not true. It's actually a very wrong assumption to make of men in nursing, and I have been fortunate to work with some pretty amazing men in my career. And we, as nurses, as their colleagues, have to work very hard to really stop the stereotyping. We need men in nursing because men and women do think differently. That's okay. We can say that. That's a fact. We do. And actually, isn't that the right way? We take the best of both and bring it together and problem solve, but also we care for 50% of our population, well, technically 49 and change percent of our population are men. So we need to have men because sometimes men need to be cared for by men. Is there a male advantage? And just, something for food for thought. The interesting thing about men in healthcare, in nursing in particular, is that what we do know is men who get into nursing tend to have a more success at climbing ladders than females. So hiring and promotion. And there's a great article by Walker there back in 2011 who actually studied the trends. And typically these salaries are slightly higher. Now, I'm sure all the gals in the class are like, what? But it certainly is advantageous if you're a man and you want to come into nursing. And we want nurses who come in and actually contribute to patient care. But we also know that men leave the profession easier or more often than females do. Because of some of the working conditions, it must be very difficult to come in as a male and you're surrounded by a lot of women. So this YouTube video is a great video about men in nursing. I want you all to look at it. It speaks to some of the national and local campaigns that exist to attract men to nursing for sure. There's professional organization for men in nursing, just so you know, and really, we really have to look at this. No different than diversity when it comes to ethnicity. We need more men in the field so that more male students can be mentored. I was fortunate to work with a team at that college in Boston, and there were many of us. There were 22 faculty members, and we actually did have, excuse me, two full-time. Two of the faculty were men full-time, and three actually. We went up to three, and of the clinical instructors, we had about 20 to 25% of our clinical instructors were male. So that was a wonderful thing, and the students loved that. Generational trends in nursing, since we're talking about trends in culture. Veterans, 9% of workforce are veterans who are out there working, and they also have a unique introspective into what nursing is. Some of them worked within nursing in the branches of the military, and some served in other ways in the military, and then took their training to become nurses. And then baby boomers, and this is anyone born between 1943 and 1960, and these are the folks who will be retiring or have retired or should have retired, maybe, I don't know if that's the right thing to say, but 1943 to 1960. So we're talking about folks who are 58 and older. And look at that, 47, almost half of the nurses in this country are breathing down retirement within the next 5 years. So can you see where the nursing shortage is starting to stack up? There is a trend, just so you know, that baby boomers don't retire at 65 anymore, and we do see that. So that has impacted, if you want to look at just numbers, I'm not sure that those are super reliable, but Generation Xers, those are your 1961 to 1981, I'm an Xer, is 42% of the workforce. So let's add those two groups up, because if you were a Gen Xer, half of the Gen Xers are approaching or at 50, 40s to 50, right? So mid-age and higher. And typically after 20 to 25 years in practice, some nurses may need to leave the bedside, maybe go into administrative. It could be based on lifestyle, physical injuries, things like that. So if you add those two together, we're looking at well over 80% of the workforce are 40 and over, right? So half 50 and over, and nearly half in their 40s. And then the Generation Y, these are our millennials born after 1982, 2%. So we know we have to attract young people into the profession, but the profession itself is not attractive to our young people because it's holidays, weekends, night shift, and some folks look at nursing like it's menial, right? Like, oh, I could, get a job making $75,000, $80,000 at a desk, Monday through Friday, get vacation. But we have to look at nursing and show some of the other rewards, and that is that contributing to a need that exists, will always exist. You'll always be gainfully employed, and it's about problem solving. So we're starting to see a change, that young people are starting to look at this career option as promising. And then the best of the generations, we know, right? The veterans, they bring insight about tasks and how to get things done efficiently. The baby boomers, great mentors, hard workers, very loyal. Generation, they don't leave. Generation X's tend to be creative, innovative, and really know how to look at an outcome and meet those goals. The Gen Yers, these are our young people, civic duty, volunteering, technologically savvy, super important in this field. So, national campaign to increase diversity. Here's all our position statements going all the way back to 1997 that we have to really look at increasing diversity. So, and then finally, we'll end this on a culture of kindness. Okay, we've talked about the culture as it relates to ethnicity, gender, and age within our field, but then also a culture of kindness. Sometimes it's about accountability, and sometimes it's just about basic kindness. Really knowing that if we're going to contribute to the nursing culture, and that is a culture in and of itself, that we want to build a gentler, better culture amongst ourselves. I don't know if you've heard the term that nurses eat their young, like nurses get hard. I don't know, should we be hard? Some of these things are just like little examples of how we could be kind to one another, respectful of one another, making sure that we, that saying, I've got your back. Doesn't mean we cover anything up, but it does it, like instead of cutting each other down, let's build each other up. There's a nice little YouTube there about the culture of kindness. And then I leave you with this thought. Will you be culturally competent, meaning taking the time to understand the people that you care for? And will you be kind and courteous as a nurse? Food for thought as my last few words for this semester to you, the next generation of nurses. See you next week for finals. Good luck.